This webinar is hosted through the New England Prevention Technology Transfer Center, the New England PTTC, which is a program funded through the Substance Abuse and Mental Health Services Administration through a cooperative agreement. The PTTC provides training and technical assistance services to prevention professionals and stakeholders in the 6 New England states. Products include in-person, distance learning, and online trainings, as well as prevention tools and resources. The New England PTTC is one of 10 regional centers and 2 national focus area centers providing these services across the country. You can learn more about the New England PTTC or other PTTC regions at our website, pttcnetwork.org. The PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. The use of affirming language inspires hope. Language matters. Words have power. People first. We invite you to incorporate these practices into your own work as well. So now I want to welcome you to today's Prevention and Action webinar hosted by the New England PTTC. The topic of today's webinar is Data-Driven Vaping Prevention Messaging in New Hampshire and Maine. So in today's webinar, we are first going to hear from Jessica Morton and Christin providing an overview of the Save Your Breath New Hampshire Youth Vaping Prevention Campaign. Then we're going to switch and hear from our team from the Maine CDC and Rinck Advertising, providing an overview of the Vaping Don't Get Sucked In Maine Youth Anti-Vaping Campaign, and then we'll have plenty of time for questions and discussion with our panelists at the end. So I am now going to hand it over to our first presenters, Christin and Jessica Morton, to tell us about their work in New Hampshire.
Hi, everyone. Oh, am I unmuted? Good. Today I will be presenting, and so will Jessica Morton, and I'm going to let her start.
Thanks so much, Christin. Can you hear me okay?
Yes.
Great. So Christin and I are here to tell you a little bit more about our Save Your Breath campaign, which we recently launched. But before we get started, I wanted to give you an overview of what we're going to talk about today once Christin gets the slides going. Perfect. So this is kind of our logo with our GIF, and it's a collaboration with JSI as well as the New Hampshire Division of Public Health Services at the Department of Health and Human Services. Next slide. So today, what I'm going to share with you, as well as what Christin's going to share, we're going to go over a little bit of the data that we saw coming in regards to the New Hampshire Youth Risk Behavior Survey from 2015 to 2019. And then I'm going to jump into this youth vaping formative assessment that we wanted to have happen, because we wanted to look at peer crowds and we wanted to assess which ones were actually using the devices to kind of make the marketing campaign even broader. And then we're going to jump right into what the Save Your Breath campaign is all about and how that campaign works for youth in New Hampshire right now. And then finally, we're also just going to share a little bit about the My Life, My Quit, which is the tobacco quit line for youth in New Hampshire, which some of you may or may not be familiar with. Next slide. So a little bit of background. I think this is pretty clear across the country, and in New England, we're not surprised by this, but in 2017, our e-cigarette use was at 41% for youth, and it jumped up to around 50% in 2019 based on the New Hampshire Youth Risk Behavior Survey. And since 2015, we've been concerned about youth using these vaping products. Next slide. So in terms of the data, this is one of the questions from the Youth Risk Behavior Survey, looking at it from 2015 through 2019, as well as cigarette use for youth. So you can clearly see the blue boxes are the cigarette use, and what's really great is we're seeing that decline in cigarette use for youth, but you'll see that the electronic vaping products slightly we're raising through from 2015 to 2019, which was definitely a huge concern for us in New Hampshire. We don't typically look at the youth tobacco survey, but our youth risk behavior surveys are the numbers that we look at on a regular basis in terms of assessing any kind of trends that are happening. Next slide. So now when we look at it, the same data, but based on grade level, just like with cigarettes in the past, you can see as they go up in grade level attenuation, the numbers start to increase. And what I think is really interesting is kind of looking at, so the 2015 data is that those yellow bars, the purple bars are 2017, and then the 2019 are the gray bars. And what's kind of interesting is the gray bars for 12th grade almost represent the, like if you look back based on the years, like I'm trying to explain how I saw this, but basically every year it looks like they've jumped up even higher than the previous set of data. So we're starting to see them even starting to use even younger, which I know most of you are probably familiar with, even middle schoolers using these vaping products. Next slide. And then we looked at from males to females. And initially in 2015 and 2017, we did see a higher level of male use, but in 2019, it's pretty equal across the in terms of sex. Next slide. And lastly, we also wanted to look at it by race or ethnicity. And for those of you that don't know about New Hampshire, although Maine's I'm pretty sure is really simple, pretty similar. About 85% of our population is white. So in order for us to see a jump in Hispanic population, it was kind of surprising for us to see that Hispanic use actually be the ones that are the highest out of Black, Hispanic, or whites. So it's something that we're going to be looking into for the next couple of years in terms of actually looking at where the Hispanic populations are located, which are pretty much our city centers, and then focusing on doing some outreach to them so that we can assess and assist them in the future. Next slide. So our project, it was kind of, we were really grateful. The governor of New Hampshire knew that there was a vaping epidemic that was going on in 2015, and we were able to get money put into our general funds to help do a project on electronic nicotine delivery systems. And with everything going on, there was a lot of talk and discussion in regards to looking at peer crowds at the time. And so that was kind of our first step as we jumped into looking at ENDS use in New Hampshire. Next slide. So our goals of the formative assessment were to estimate the size of peer crowds in New Hampshire, in terms of the electronic nicotine delivery systems by peer crowd. We also wanted to look at the knowledge, attitudes, and beliefs related to ENDS use for each peer crowd. And we did that similar to what the Youth Risk Behavior Survey did. And we did this in 2019. And our goal was to really kind of we looked at a lot of the survey questions from the Youth Risk Behavior Survey, monitoring the future. And then we also added a lot of imagery to the questions. Unfortunately, we were not able to add these questions to our Youth Risk Behavior Survey. Otherwise, it probably would be a bonus for New Hampshire, but because of the way the survey is run, it just wasn't feasible or possible at that time. Next slide. So the ENDS project in New Hampshire, we were able to look at 60% of, and Christin, why don't you jump in here?
Oh, sure. Can you hear me?
Yes.
So when we did the project, we conducted an environmental scan, and we did multiple focus groups, and then we conducted this statewide survey that you were talking about just now, Jess. That was for age 13 to 18, and it was fielded from June 2019 to the end of October, and we got a total of 2,220 valid survey respondents. And what we found was that the overall prevalence of using a vaping device was 60% from our survey. And that's significantly higher than the other survey data that Jess was just talking about. But it tracks more closely with that recent 2019 data point of about 50%. I'll hand it back over to you, Jess.
Great, thanks, Christin. Next slide. So in terms of the results from that survey, as you can see here by the pie chart and also by the chart on the right, there really wasn't a specific peer crowd that jumped out and were above the rest in terms of use. We were seeing that actual vaping use is actually being used across all of the peer crowds in New Hampshire. Although we could say country, local, and mainstream were our highest, but there were still some areas like even the unassigned, which was problematic when we were trying to figure out how to assign everybody in a specific category. And so you can see on the right-hand side, the majority of them in terms of ever use and current use, they're all across at least 50% or more. Next slide. So some of the questions that we looked at, we asked a lot of questions about beliefs and attitudes about vaping. And again, this doesn't show a big difference across the peer crowds. It really just shows that a lot of them were okay. They knew what was great is that they do know that they're as addicting as smoking cigarettes, but they don't feel like they do feel it's okay to vape socially. They do feel like if you only vape socially, you're not really a vapor. They think that vaping is a great way to start a conversation. They think you look cool, and they think that it's not a big deal if friends vape for the most part. There were some areas where there was some discrepancy in terms of the percentage points and the overall value for the belief or the attitude, and those are marked in red. But overall, there isn't much of a difference between the peer crowds. Next slide. And so one of the other questions that we actually asked two different questions in terms of trying to get at them in regards to why are they currently vaping? And this question really gave us a good picture of the reasons why they're vaping among the current users. So they like the buzz or the feeling. That was very important to them. They thought it made them look cool. They thought it was less harmful than other forms of tobacco, and then they're easier to hide or be discreet with, and they're available in flavors. And again, this is of course way before COVID hit, so this survey could be completely different now that after COVID hit. We're not really sure like where our numbers are at post-COVID, or in the midst of COVID, I should say. Next slide. So in terms of looking at another thing that we looked at was we asked them within the last 30 days, how many times are you using? And so those that used at least 10 to 30 days a month were at 28%, which is a relatively high number. So we know that their brain chemistry is starting to really become addicted to these products. And that's definitely a concern for us in trying to help the youth of New Hampshire. Next slide. One of the other interesting things we saw was that 2 to 3 times per day someone using was at 57% of those that said that they were current users. So they're not just using it once, or they're just not, and again, in terms of the frequency, like exactly what they're using, we don't know those exact things, but they're not just using it one time per day. Next slide. And then the other thing that we really thought was really interesting was that came out of this was the idea of ever use by depression status and family life characteristics. So if they suffered with depression symptoms, they were more likely to use the products. If they live with someone who had alcohol or substance use problems, they were, again, more likely to use the products. If their parents talked about it with them, then they were less likely to use the products. So again, it's that conversation, that dialogue that parents need to have with their children, that they might be able to alleviate them from actually becoming a vapor. Next slide, please. So in terms of the end results from our survey, we felt that the campaign should appeal broadly or to each peer crowd by incorporating survey data on musical tastes, interests, and self-descriptions. We also felt that the campaign had to incorporate special consideration for youth experiencing mental health issues or substance use issues in their home. And then lastly, we did our research in terms of looking at the environmental scan. JSI did a great job of figuring out which existing campaigns were already there and addressing some of the survey respondents' beliefs relative to the ends use, harm, and acceptability that could be tested alongside new messaging for a New Hampshire ends prevention campaign. Next slide. And now I'm going to turn it over to Christin, who's going to tell you more about the campaign concepts. And I think you jumped ahead. There you go.
Thanks. Yeah, when I clicked my microphone, I actually advanced the slide. Well, thank you, Jess. So the creative process and testing. So just what Jess was talking about is we took messages and campaigns that we saw out in the, currently in the landscape in the United States, and then we took from our research messages and imagery based on survey results and the focus group results to do A/B testing with the creative so that we could narrow down elements that would be receptive to the audience that we were trying to reach. And we came up with a few concepts. So based on those results, we created concepts to present to the state of New Hampshire. This concept is called No Vape NH. It's based on the concept of desirability and looking cool or popular. And we intended it to kind of emulate a dating app a bit. And a lot of the language spoke to how vaping can affect your relationships, both romantic or friendship. This concept, Last Breath or Save Your Last Breath, focused on the health effects of vaping, including the immediate health effects that were prevalent in the media at the time. So this was just when all the EVALI cases were coming up in the news, the research was new, and we were seeing pictures and stories about youth being hospitalized across the country, and this campaign was tying into that. And then this third concept, Refill Your Kill, focused on the health effects of the product on addiction and really understanding that you'd be becoming a slave to your product and the manipulation of the tobacco companies and how youth could stand up against tobacco companies and see what they were doing as a lie. And the final campaign choice ended up being a combination of two concepts that we felt pulled in messaging and imagery nicely. And so it's Save Your Breath, and it's aimed at youth in New Hampshire, age 13 through 18. And it has the goal of informing them about the dangers of the chemicals and health risks associated with vaping, and of course, to get them to quit if they have already started using the product. We focused a lot of the language on the deception, the tobacco lies, the fruity flavor, and how that is hiding and masking the danger of the product. And we tried to incorporate some copy that played into that, like More Than Mango and Beyond Blueberry. So the campaign will run through November, and then we will work with an independent contractor to conduct an outside evaluation, again, based on the campaign, and to see if there was maybe a change in knowledge, attitude, and belief, and look at campaign ad recall. I did want to touch back on something that Jess was talking about, just to make sure, when she was talking about peer crowds and peer groups, because I'm not sure if everyone's familiar with that concept. And so we were looking at segmenting youth. We validated peer crowds that are out there in the research and literature, and we did validation in New Hampshire and some other work in Vermont. And so peer crowds, well, each individual has like a local peer group that they socialize with, and both the person and that group belong to a larger peer crowd that share cultural similarities, values, activities, aspirations, and style. And so it really is tying into that, the social norming theory, understanding that social norms refer to values and beliefs and attitudes. and that they can function as an unspoken rule or guideline for how people behave and potentially adopt behavior. And this is something that in the research has been found in youth and young adults, and people usually tend to age out of this as they get older. And what you're looking at right now are the key messages for the campaign. And so again, we wanted to draw out some of the findings from the survey about anxiety and depression, and how becoming addicted to a product is actually going to exacerbate that versus alleviating it. So the goals really obviously were to get youth to not pick up the product or to stop vaping, but also reframing the way that they were thinking about it, to not think of it as harmless, and to aim the way that they think about the product being sold to them. So behavior change campaigns are difficult to measure. You need to have an elongated campaign to really look at the prevalence or behavior changing in a population. And so with smaller campaigns, it's easier to track message, ad recall. And so our key performance indicators really focus around engagement. We are encouraging interaction and interest with our posts and ads. We are utilizing the cessation resource that was developed by National Jewish Health, the My Life, My Quit. That's a text entry, I think, that ultimately goes to phone counseling cessation services for vaping. And then we also provide some of the national resources, such as the This Is Quitting by Truth or Legacy. These are the digital channels we're on with paid and organic. We have faced some significant challenges recently with Facebook with this campaign that we have not seen in the past in running similar copy, or not even similar copy, but similar, like just similar phrases and imagery, although not this campaign. And I'm not sure what's going on with them. We've had some, we just keep getting flagged with some of our posts as trying to promote nicotine to youth. We have had significant success on TikTok and also on Snapchat. And the creative is very engaging, and we have a lot of video. And I think that that makes a big difference for this target market. Here are some of the sample materials. So we've done a lot to combine illustration from some of our illustrators with photography, and kind of playing off of those fruity flavors and how the fruit flavors are hiding the danger of the product. I'm going to try and play a video for you. If it doesn't work, I will give up. Let me see if I can do it. See if it works. So I hope that that just played something for you and that you just did look at my screen quietly.
It did. We could hear it.
Oh, good. That's such a win over the Zoom platform. So the website integrates our social directly into it. So all of our Instagram advertisements and posts come right into the website, making it constantly fresh for our visitors. We're developing some more interactive content, so some further animation of health effects and a game that will be embedded into the site. We are working through other channels. There's the Save Your Breath Partner Toolkit. We have a strong prevention network in New Hampshire, and the network is very interested in being able to co-brand and share our materials for the campaign, and they work very closely with the Tobacco Prevention and Cessation Program on many statewide initiatives. We've also created posters for the partners in the schools, and we have developed campaign branded face masks, cloth face masks for the schools, because in New Hampshire, there is really a at your own SAU model. So each school has made their own plans around if you're doing in-person or a hybrid. And so face masks have become very big necessity, obviously, for everyone. And then we are working with youth influencers. We started to develop some relationships with some youth that have been interested in the campaign, as well as working through the partner network. So this is the partners toolkit page. And we're also running a mask contest right now. So kind of just in time for Halloween, many neighborhoods in New Hampshire are allowing trick-or-treating. And as I said, in school, youth are required to wear a mask all day long if they're in person. And so they need to have a lot of masks that they can wash and wear. And so we have the contest so people can share their mask selfie with us. And that is a great way that we're finding a lot of youth that are interested in being influencers. And so here you're seeing the masks and a poster and some of our ad copy. And I don't know if anyone has any, if we're doing questions now or at the end, I can't remember, I'm sorry.
Yeah, I think this is Kristen. We have time for, we can pause for a minute here if anyone does have questions. There was one chat to me where somebody wrote, let's see, were campaign ideas created by prevention staff and agencies or through an outside marketing company? So maybe you could just clarify that.
Yeah, and I probably didn't even introduce myself because I forget sometimes. So the state of New Hampshire contracted with JSI Research and Training Institute Inc., or John Snow Inc., which is where I work. So we are a public health consulting firm. And we have, my role at that agency is to do health communication or behavior change campaigns. And so we work very closely with the tobacco program in developing not just the creative, but also the whole arc of this program. So the research to lay the groundwork and understand where we need to go with the campaign testing, and then evaluation and outcome data at the end.
Thank you. And then there was one other comment. How did you get youth to engage in the contest? We've tried youth contests on Instagram and no interest. So do you have any tips?
Yeah, I think it's because the youth really want masks right now. And they have really, from what I can see, taken a liking to the look and feel of the campaign. Not just, and this is hard because we've done 1,000,001 campaigns, and it's hard to get youth to want to wear anything that the campaign's on. But in this case, they seem to. And then also I don't know if you saw, we're offering them that they can win $100. And so that is certainly an incentive.
Definitely. And then there was just one last question, and then we'll switch over. I don't know if you would be able to share, but somebody asked, what was the overall cost for the full campaign? Or maybe you could share some elements of.
I think for Jess, maybe, I don't know if you want to answer the question or if you want me to just answer it, or what would you like?
Sure. We can certainly just say what we contracted with JSI for. So we, I want to say we've been contracting for 3 years. The last 2 years have been $220,000 a year. And before that, it was like 60,000 to kind of like kick off everything. So almost like a little bit about approximately 500,000 in the end of this whole thing. So from start to finish.
And that really covers like the statewide assessment, which that was fielded through social and digital. And so there's a cost to the recruitment of the survey itself, and then through implementation. And we didn't mention in here, we also did a movie theater ad early on in the campaign. The program, because we were still in campaign development and testing, felt that we really needed to have something out there. We had so much data already. We were able to create a video for the movie theaters that ran statewide, that we also ran on YouTube and Google for paid promotion. So it's kind of been like a long arc. I would say that this campaign itself, we have dedicated about $30,000 to digital and social promotion alone, which maybe, I'm not sure if that was really the intention of that original question.
Thank you. Okay, so we are now going to switch over to hear from our group here in Maine. So Nikki, I am going to make you the presenter now. And we'll let you all introduce yourselves as well, and the floor is yours.
Great. David, you want to kick it off?
Sure. My name is David Piet, and I work at the Maine Center for Disease Control and Prevention within the Tobacco and Substance Use Prevention and Control program. Do others want to introduce themselves before we get going?
Sure, and I'm Garth Smith, also with the Maine CDC in Tobacco and Substance Use Prevention and Control.
And I'm Nikki Jarvis. I'm a senior account manager with Rinck Advertising, and we contract with the Maine CDC to work on the vaping campaign and several other prevention efforts.
And I'm Elizabeth Daniels, and I'm a senior project manager at Rinck and work on the day-to-day stuff with Nikki.
So I'm going to give just a quick overview of kind of how we got started with this project, and then hand it back over to Nikki to give a more detailed presentation on some of the steps that we took along the way. So if you could go to there we go, the where we got started slide. For a few years, we had a youth anti-tobacco campaign called You Are the Target that was running and did really well. It focused on kind of questioning big tobacco, their motives, and youth questioning whether or not they were being manipulated by big tobacco. It focused on vaping as well as all other tobacco products. It started out mainly with cigarettes, and kind of we worked over the years, we worked more vaping content into the campaign and adjusted it based on the learnings that we saw of things that worked well. We knew out at the community level and from national input and just information from the program level that the vaping use by youth was on the rise. Where a lot of input from schools looking for more information, more assistance with how they could help with what was going on at the school setting and other community settings. And then we did get more state level data through the Maine Integrated Youth Health Survey. And between 2017 and 2019, there were big jumps in ever having used at the high school level. Those who had ever used vaping products went from 33% in 2017 to 45% in 2019, and current use pretty much doubled, going from 15% up to 29%. And another red flag that we saw was a youth not understanding what exactly it was that they were vaping, with almost, well, in 2017, more than half thought they were just vaping flavoring. So needing to kind of raise awareness in that area. So all of those factors kind of contributed to where we started here on this slide, with the need for more of a vaping focused anti-tobacco campaign to reach Maine youth, with the objectives similar to what New Hampshire had: convince youth to stop vaping, convince youth to never start vaping, educate youth about the dangers and misconceptions of e-cigarettes and vaping, and the overall goal of reducing and eliminating the amount of Maine youth who are vaping. So next slide. So we looked at the landscape of what was out there for campaigns, including, looking at what we had in our "You Are the Target" campaign, what had been successful there for the messages that we had as we added more vaping content, what had more interaction, looking at other states' campaigns and seeing what had worked and kind of what we liked. Assessing the messages and the platforms that were used that were effective in reaching youth. And again, that was looking at what we knew of from the campaign that we had run with "You Are the Target," but also exploring other campaigns and Rinck kind of researching into the latest and greatest on reaching youth and the platforms that work best for that. We developed new concepts to test with key stakeholders, Maine youth and youth nationwide. We tested styles with audience to determine the look and feel for the campaign, the different colors, fonts, and graphic elements. Throughout the whole process early on and as we developed, we did get a variety of input from a lot of different sectors. The youth was certainly one and probably the most important to get the input from. But there was also a lot of public health partner input from various levels, US CDC public health folks through the tobacco project officers that we had and others that focus on tobacco work were helpful in providing direction, both as we worked on the concepts, but throughout development, very helpful and open to providing feedback on things. And of course, at the state level, through the public health leadership program folks, there was a lot of input. And as you might expect, the input did not always align from those different groups. So it was a bit of a puzzle to fit in all the different feedback that we received and try to come up with the best campaign that we could that would meet the needs of Maine youth and input of others as well. So with that, I'll hand it over to Rinck to talk a little bit more about where we went from there and what we developed.
Thanks, David. So again, I'm Nikki. I'm with Rinck Advertising. We are the contractor for Maine CDC. And, as David mentioned, we were coming into this challenge, if you will, already 2 years into another vaping campaign that we had established with the CDC around, which we had called "You Are the Target," which was educating youth about them being the targets of the tobacco companies. So we presented 3 different concepts to really get at the goals that David mentioned earlier, to educate around, the harms, to get youth to stop vaping, but also we recognized that we had a huge percentage of youth in Maine that were already vaping. So this is just an example of one concept that we presented, similar to how New Hampshire went about their presentation as well. Ours was called the Vape Escape, and this was really around the mindset of addiction and escaping that addiction and escaping that deception from tobacco companies, or really escaping that temptation that might be set up around peer pressure. So we were asking every youth to really escape the vape at that moment. We thought that there could be a lot of environmental things that could work out, where we would have individuals turn in their vapes, et cetera, et cetera. So we presented that as one option. We also went a little bit edgy and went straight to Vaping Sucks. We knew that, we wanted to have language similar to what youth were using. We had heard in several focus groups from anybody that used, or anybody that was around friends who used, that they would just always say, "Vaping sucks. Like, it's consuming. I don't want to do it anymore." And so what we did is we just took their language and turned it into a concept. We also knew that based on some of our initial research as well, in Maine, it wasn't just one segment of the population that was using vape products. We were having multiple. We were having athletes. We were having preppy kids, similar to what New Hampshire was experiencing. And so we needed to be able to talk to that and speak that language. So we proposed this as concept number 2. Then concept number 3, it didn't step that far away from what we had been running, which was You Are the Target. This was called Test Subject. And this was really about youth being the lab rat, really, and letting them know that they were being that test for tobacco companies. And we were testing sort of those unknown ingredients, those harmful ingredients, and things that we just didn't know on them. And we were asking them, are they willing to be tobacco companies' test subject at that time? So we actually, we pulled all of those in, and we pulled all kinds of different tested styles, and you can see 3 examples. This is just the test subject mocked up, but we did the same for all of Vaping Sucks and the Vape Escape. And we went out and tested this, all 3 campaigns, with 200 youth in Maine and 200 nationwide. Because we did nationwide because we wanted to see what's trending. We did it through a platform called Ask Susie, which is a crowdsourcing platform that we were able to get kind of on demand and live results almost immediately. Because at the time when we were going to launch, we were conducting this research over the holidays, over December, right around Christmas and into January. And our goal was to get this campaign launched in January. So as you can see, so we pulled together all of this research and did additional, the additional Maine research with the youth, 200 of those through SurveyMonkey. And we were able to understand what stylistic, what font, what typography, what graphic treatments they were most drawn to. And I can tell you, based on this, they were most drawn to the one in the upper left, top upper left. And you can see as we go down further how we implemented this into our campaign. And Ed, Elizabeth, feel free to jump in too and give any additional notes, if you will. So as we presented all of the findings to the Maine CDC and our partners, because we also had our key stakeholders take the survey as well to get their feedback. Vaping Sucks actually rose to the top. It was the #1 selected concept. However, as David mentioned, as you know, as it would turn, it was a little bit maybe too edgy. So we did change the language to vaping don't get sucked in. And we do have additional language on our website and through our messaging where we educate around like vaping, know the facts, vaping, get the answers. So we were just using that, but most of our language, we do use language around vaping sucks, vaping don't get sucked in. So moving forward, we knew our execution would be on traditional and media platforms, digital media platforms, primarily on digital media platforms. Traditional was just to enhance the outreach on digital. And we secured funding through the state to run this campaign for 2 years, which is just fantastic. We typically run for 3 months at a time, take a break, assess, and do additional research, and then make sure our messages are on point, and then we continue and just make sure that everything's continuing to resonate, that our targeting is working, et cetera, et cetera. And then our message is also focused on prevention, the prevention aspect and the treatment aspect. Prior to this campaign, our other campaign only focused on prevention. So it was nice to incorporate treatment, knowing that we had seen such a high spike in e-cigarette use through our Maine Integrated Youth Health Survey. But what we did is implement through This Is Quitting, a text to quit option, so that we could provide that as an outlet for those seeking treatment. And we work closely with our quit line here at the state in order to provide that.
Yeah, so the text to quit was specific to Maine. So we did have, text Maine to 88709, which you'll see throughout the creative here. We wanted to be able to track our data specifically to our state and how our media and other community outreach and how the results kind of followed through. Otherwise, we would have to, track it with national data. So having the specific Maine text line was key for us to be able to track our results.
Thanks, Ed. So again, this is just an example of our website. It's vapefreemaine.com. You can get there by going vapefreemaine.org as well. You can see we have a facts, a risk, and a quit vaping section. We also implemented a quiz section that was to drive individuals to the website, kind of to lure them in to see how much they actually understood, like behaviors, insights, and kind of gather that information. They can take a simple yes, no, and then we can provide them with the answers, but it also allowed us to gather insights on how much do youth actually know about certain topics around vaping. So it was also an information gathering piece for us. During the development of the Vaping Don't Get Sucked In campaign, we also, as you can see, we've incorporated the color scheme, but we used real Maine youth. We filmed and utilized all images from an iPhone so that we can make it a little bit more raw and a little bit more realistic. And so all of our TikToks, all of our video, everything like that was filmed with an iPhone. And Mainers from the Maine youth from all over the state were used. And that was done strategically in order to get youth talking to other youth about them being in it, sharing it to their Instagram stories, in a way to kind of additionally spread the message a little bit more organically. So you can see here that these are just examples of some paid social ads that we implemented. Again, just we have various ads that went out. We ran on multiple platforms, TikTok, we ran Instagram Live, social stories, and we encouraged, obviously, the youth to share. As New Hampshire mentioned, we also have a huge collaboration with our community partners at the statewide level. And so we also developed community posters and distributed toolkits as well to our partners to implement at the community level. And we have, in Maine, we have a Maine prevention store where individuals are able to get free resources of our campaign, which has been really great. This gives just an example of all of the media platforms that we ran and kind of how we kind of strategically space it out. So as I mentioned before, our intentions were to get the campaign up in January. But as life would have it, it was ready in January, but due to approvals and due to COVID, we struggled getting it out any sooner than May. Our state, just like many others, just kind of shut down, and we found ourselves just trying to kind of grasp to get it back out on air. So the fortunate part was it was ready and it was already up there. It was already with our state for approval, and we were able to get it out in early May. And we ran for a couple of months, and then typically we do take a break, we assess and run focus groups, and then we will run again in October through the end of the year. And you can see the media platforms, which is quite a bit as far as mostly digital. And when we select media platforms, we select them with intentional KPIs, so key performance indicators, for different reasons. So for example, TikTok, we would say we intend to have TikTok drive high engagement, or Snapchat drive individuals to the quiz. So we always look at what is the funnel for these platforms, and what is their intention, and what are they supposed to do. So some just high level outcomes for our campaign. This is just based on the first 60 days, because as I mentioned, we're getting back out with flight number 2. We had close to 16 visits to the website, and we had 182 texts to quit vaping in that first 60 days. So about 3 youth that looked to quit vaping a day, which for us was considered a success. We're hoping that it will continue to go at that same level. And then some additional things that we like to measure, when are teens most likely to engage? And in the morning between 9 a.m. and 10 a.m., this was kind of during the time of COVID. They were out of school or in a hybrid model. They were engaging, and we saw the highest amount of clicks and post engagements for Instagram during that time. And interestingly, TikTok resulted in our most text to quit to this is quitting, which was 68. And then YouTube also had a high number, which was 59. So they resulted in almost, half, or if not more than half of our text to quit to this is quitting. We also, in the 60 days, measure the quizzes completed. So we were averaging about 3+ per day, and had about 230 quizzes completed. Snapchat and Instagram resulted in obviously the most completed quizzes. So that just gives you an example of what we were setting out to do as far as those digital platforms. We were driving them specifically to fill out the quizzes. And then for us, we like to measure our reach. In Maine, we have several towns, but like how many towns were we reaching? How many youth in various towns were we meeting the needs of? And for this particular campaign right now, we're hitting about 73 Maine towns. We received various text to quits from. Obviously, the higher the population, the more text to quits we were receiving from. So, as I mentioned, we took a little break. We take a break after, and we assess messaging and kind of where we stand. We're also in a unique position because COVID was going on. So what we wanted to do is go out with the first flight and understand, are these messages around vaping sucks and vaping not getting sucked in, does this resonate with the teens? California has a campaign around nicotine and brain poisoning, and we wanted to test our messages and against their messages, but really also understand individuals' mindset around COVID as well, and kind of where they are in this current space. So we did 7 focus groups throughout the state of Maine that were all done via Zoom, and we do these quite often, and they're quite successful actually. And obviously you can read these, but what teens were most nervous about were the side effects of vaping. It's a lot of unknowns to them. They're just still very confused about them. And obviously the side effects that they brought up most often were around lung issues, the anxiety, the irritability, and of course addiction. But we had a lot of kids say that they just think that vaping is not cool anymore. Like they want to tell either younger siblings or friends that it's not cool anymore. And this is coming from those that actually use, or in some cases, hadn't used. So, but most of them were saying if they had used that, it's just not cool anymore. And then of course, almost all of them said that their first vaping experience started with peer pressure. And then, we asked them, what was it, if we had any ideas about like, what would it, if you had to quit, what would make you quit? Some suggested obviously higher costs, a new job that was vape free, or something that was very serious. And, those are all things that we've all heard before. But this next one we found particularly interesting, especially for our community partners who work with the schools. They wanted more peer support groups within their schools. And what they found is that, schools will say, hey, we're a resource. Come tell us, if you need any treatment services. But what they felt is the schools are actually an authority figure, and they didn't really feel safe going to them and telling them that they vaped, what will be the consequences, what will happen after that. So they felt if there were some additional peer support that they could go to within the schools, they'd feel that that was a better structure for them. And then of course, Snapchat was the most used app, but also that a lot of youth were selling their old jewel or flavors or materials through Snap Stories. So, how, a lot of them didn't agree with that behavior, but that was happening. And it was this notion of how do we make that stop? It probably shouldn't be happening. So those are just some focus group insights that we took away from right after the first flight. So as we move into phase 2 of the campaign, which is October to December, we're going to be implementing additional messaging. We heard most youth obviously liked the shorter videos, the 6 second and 10 seconds, which we have in our current campaign. And we've kind of eliminated some of the 30-second the ads, which is what California had, but they did lean towards the messaging that was based around behavior and mindset around what it would do to them versus the tobacco companies. And I think that was based on the fact that we came out for 2 years and educated them on what the tobacco companies were doing. So I think they're ready for that next phase of messaging. And then additionally, we're going to be addressing new audience segments and disparities, targeting specifically reaching, in our state, it's very hard to reach rural Mainers, but also low SES and LGBTQ+. So these are some things that will be happening as we look into the next phase. I think that's it, and I'll turn it over to David and Elizabeth or Garth and see if they want to add anything additionally.
I think just checking in to see if there are any questions that folks have, unless Garth or Elizabeth have anything to add.
Let's see. We do have, there was one question that came in towards the beginning. I think you elaborated on this a little bit more, but what was the role of youth in having input in the creation of the ads? I know you talked about the focus groups, but kind of in the initial development, was there a role for youth in that process?
So,
Yeah,
go ahead.
Oh, you want to go? You go, David.
I was going to start and then you can add to it. There was the development of the different concepts, and the different look and feel for each of the concepts, and all of those were shared with youth. So they were able to provide input on which overall concept they liked and which like imagery and color combos they liked as well. So we were able to take sort of both sides of that input from the youth and incorporate it into a final product.
One thing that happened too when we were filming with the youth, the Maine youth, is that we learned a lot from them while we were filming with them, because our creative department really got to chat with them and get them comfortable in front of the camera. And so there were some things that kind of came out of filming with them too, that kind of came into the messaging once we started developing that as well.
Great, thank you. Another question that came into me was, were there any surprises in the quiz results? And sort of unexpected answers there.
I don't know, actually. Do you know if there was any? I mean, I think, I actually think
nothing really too unexpected. I mean, most of it was messaging that we were putting out in the ads as well. So we were kind of hoping that they would know some of that information. And once they get onto the site, we're hoping that they explore more of the information onto the site too. So after they're taking the quiz, we really want them to engage further. So it's almost like just a way to get them onto the site to engage and interact from there. All of our questions were actually true-false questions, and all the answers were true. It's kind of hard to pose a question in a way where you don't want the youth to think that we're encouraging them either. So that was a little bit of an obstacle there, but yeah.
So I don't see any, oh, there is another question that just came in, and just a reminder for our participants, you can type your questions in, and we'll see them and moderate them out. And you can address questions generally, or if you have a question specifically for our New Hampshire folks or the Maine folks, that just put that in too. There is a question here from Valerie asking if you, I don't know if you have any, if you're familiar with this, but if you're familiar with anti-vaping or vaping prevention campaign in California. Valerie works on a TUPE project in California, and they have a campaign out there. I don't know if you would have come across anything about that campaign in your research.
Sorry, Kristen, what was it called? What was the name of the campaign called?
TUPE project.
I haven't, but I'd be very interested. So we have worked actually really closely with California and through like the MCRC to gather and we share resources quite regularly with all of the Department of Health. So, I think, and kudos to New Hampshire. I think their campaign is wonderful, and it was great to see their results. And, I think as effective as we can all be at the state level to get, these campaigns out and like around anti-vaping or tobacco use is so beneficial to our states. But I would be totally interested in learning more. I think my email is in the attendees list, and if she wants to email me directly, I think that would be wonderful. I love learning more.
Great, thank you. Yeah, and I guess related to that, I would ask my own question, which is kind of, I think both, and Kristen and Jessica, feel free to jump back on now too if you want to, but what role, what other resources were there did you kind of look for outside of, I know you both mentioned, I think, some of the Truth Initiative type ads and some other federal ads, but were there other states or federal guidance that you looked to in developing either of these campaigns?
I mean, we could go, sure. I mean, we did, obviously, we worked with California Department of Health, and we tested some of their messaging, and we worked with their messaging. We also worked with the national CDC to get, I mean, obviously our local CDC, but our national CDC and Brian King to get our messaging pre-approved, which was super helpful because they've obviously vetted through a bunch of messaging. So that was helpful. And when we do some initial just kind of ground research, we do look at what other states are doing. So what other anti-tobacco campaigns are out there happening in that current moment. So we typically do a brainstorming session with our entire creative department, and we bring the CDC in as a collaborative partner, and we show them, here's what the landscape is, here's what's going on, and these are all the campaigns that are currently happening, and here are the messages that are being put out, and here's kind of where we would like to go. And we've found that to be very effective.
Yeah, we usually start our process with similarly with a literature review of any campaigns that have actually been evaluated and then the literature published. And then we do an extensive environmental scan so that we can see the landscape. California, of course, has a lot of great products out there. JSI has done some work in Santa Clara County too with their tobacco program, as well as some research with Georgia State University around vaping with adult and youth populations. And so that all comes into play, especially when we're doing our testing to make sure that our creative is landing with the youth. And definitely checking in with CDC and having them and Brian King do a review of the campaign is wonderful too. Especially as the landscape changes, we saw something interesting, which was during the Valley, when the Valley was coming out, there was all this news-related content around chemical burns to the lungs. But then as time went on, the cause of that became more clear or less clearly tied to simply vaping alone. And so just kind of doing that check-in to be able to change the content.
Thank you. And there was a comment here. This one I think is for our main group from Janie, and she writes, we had a thank you for not sucking campaign that was yanked in New Mexico years ago due to backlash about use of the word sucking. So she, her question is, once you modified the campaign title, has there been much backlash about that word, or were you able to get around that?
I would say it was a process, and there hasn't been backlash. You know, we kind of came to agreement on what the language would be and how it would be used, and there hasn't been backlash since we came to that agreement. And I think it was sort of a, you know, just a precaution, unsure what public perception would be on some of the other language. So making sure we had a good product out there that didn't raise too many eyebrows that it shouldn't be.
Yeah, we also didn't see any comments that were really negative on social about the name of the campaign. But one thing we did have to consider with, you know, Vaping Sucks is that we were going to have a YouTube channel and an Instagram page and all these social channels associated with it. So coming up with something that was a little bit more user-friendly for approval process on those platforms too was ideal.
Yeah, that makes sense. And so I had another question too, which I guess would just be, and I like that both of your states have toolkits for community partners, but for people who might not be in the great state of Maine or New Hampshire, do you have recommendations for how maybe a local coalition might start kind kind of if they wanted to create some localized advertisements on Instagram or a messaging campaign of their own. What do you kind of recommend as just some easy starting points for a group who is looking to do something like this? Just a simple question.
So we have been working with a youth group in East Boston recently to help them develop their own campaign for their own community, and then train them on what goes into making a marketing campaign, and then how to run it, and then even look at evaluation on the other end, because they felt like for their community, what Boston was running in general wasn't meeting the look, feel, need, language of their own community in East Boston, which is kind of a different community. And so one of the tools we're going to be using is enabling them to learn how to use a Canva account. And so, those simple things for any community organization, as long as they're, testing, just, having someone else come in and look at what I've made that's from the audience to, just resound it before you send it out into your social content. But, that's a great tool, I think.
I was going to say a similar process to what both Maine and New Hampshire talked about, kind of on the bigger scope, more at the community level of looking at what's out there and kind of comparing that to what the community needs are, and trying to come up with something that's in between that is more specific for the community needs, but takes in elements of what already exists and get ideas from what already exists.
Yeah, I think that's true. There's a lot of good messaging out there already, so it's not always creating a new message, but just finding what works. And then the other question was, and you both touched on this in your presentations a bit, but with the COVID changes, and I love the idea of the face masks, but where do you kind of see this campaign going in the future in a post-pandemic world, or I guess we're still in the pandemic, but in what ways has this kind of changed your initial plans for the campaigns, and how do you see that moving forward?
I mean, so sorry, Christin. So I mean, for us, yeah, it's definitely different in a little bit. We have obviously seen like an uptick for youth as far as digital use in all of the platforms. So that actually has been good for us because that just means as long as, it's good and it's bad, but we've been able to get our message in front of youth more effectively and efficiently. So that has proven to be great. But I think as far as the environmental aspect, I think supporting our schools is going to be a huge need going forward, whether it's as what Christin said, like doing masks or doing the floor prints or doing some other support, like what does that look like? Because they're really hurting. So we've been exploring different avenues to how to support our schools through community outreach, because I think that's where we're finding the biggest gap right now.
I definitely agree with what you're saying, Nikki. I think something the schools are learning how to do is what digital platform can they use to teach students half the time, right? And so adapting any trainings that we can do, it is hard to get into a school as part of a curriculum. That's very complicated sometimes, but engaging with their prevention coordinator if they have one, or the nurse if they have a health program, and adapting the campaign elements so that they can start to bring it into the classroom as a teaching tool can be great. We have a program, Tick-Free NH, that talks about Lyme disease prevention. And so we started right out with the elementary level, creating like workbooks for them and stuff that teachers can use as a component of what they might be teaching in the class.
Thank you.
The other thing is, even further down the road, New Hampshire plans on almost doing, working with the school nurses and actually doing some more assessments of tobacco use with youth. So we're hoping to do a pilot project over the next 5 years with a school to kind of help them figure out how to assess their youth on what they're already doing in the school, and then be able to give them the tools that they need to help them.
Great, thank you, Jess. Yeah, I think I love that both of these campaigns have started to also integrate the treatment component with the text to quit lines, where we're seeing a lot of use already among youth, having that outlet for the young people to know where they can connect if they are already using these products and are looking for resources to stop, is a great addition. I don't see any other questions here yet. I'm checking through my notes, but I think we covered pretty much everything that I have. Are there any other kind of comments or thoughts that any of you would like to share? Any final words? Great. So we do have a few thank yous in the comments for this interesting content. It's always helpful, I think, to hear about what different groups and areas are doing, and get some ideas for, I'm sure people are getting some ideas for their own campaigns. So I want to thank all of our presenters. I think this was a great webinar. And with that, I think we can go ahead and close out the webinar. Thank you all so much, and have a good rest of the afternoon.
Thank you.
Thank you.
Bye.